Hi there, my name is Amir Ginsberg. I'm a specialist in internal medicine and chairman of Trillium's Medical Quality of Care Committee. This short video is the third in an educational series about patient safety and is titled Safer Communication, Transfer of Accountability, and Surgical Safety Checklist. If you want to take a closer look at some of the information in the accompanying slides, please pause this video at any time. When an adverse event causes the death of a patient, we call this a sentinel event or a critical incident. The top root causes for sentinel events are listed here. You can see that when things go wrong in healthcare, a communication failure is identified as the root cause 70% of the time. So there has been a lot of effort over the last 10 years to enhance the safety of communication within our industry. In the last year, we have rolled out two important safe communication tools, Transfer of Accountability and the Surgical Safety Checklist. The rest of this video will focus on these projects. Handoffs account for 40% of communication failures that lead to death. Accreditation Canada has made effective information transfer at transition points of care a required organizational practice. A common transition point is nursing shift change. In the past, handoff information was written or it was recorded on a cassette tape by the outgoing nurse and then reviewed by the incoming nurse at some point during the shift. In 1994, a U.S. center tried to move nursing handoffs to the bedside and directly involve patients during shift change. But unfortunately, the idea was quite ahead of its time and didn't take hold. Patient safety culture has evolved since then, and some encouraging data was generated when the idea resurfaced in 2006. Bedside Transfer of Accountability, or TOA for short, was embraced by our health center and is now an organization-wide standard practice. Why does this enhance safety? Well, communication is enhanced by making handoffs face-to-face, with an opportunity to ask questions and involve the patient. And imagine, if you will, being a patient and having your outgoing nurse and incoming nurse talk about your plan of care, with you being able to correct any information that does not sound quite right. And imagine the confidence in your healthcare providers that this would foster. This project has won a National Safety Award and is attracting both Canadian and international attention, and patients and families love it. The other project I wanted to outline today is our implementation of the Surgical Safety Checklist, which is part of the Safe Surgery Saves Lives campaign. Recall that in the Canadian Adverse Events Study, more than 50% of events were related to surgery. And although it happens very rarely, throughout Canada there are still wrong site surgeries, wrong patient surgeries, and retained surgical objects. The Surgical Safety Checklist asks the surgical team to confirm that this is the right patient, the right surgery, and the right body site, and that appropriate monitoring and other equipment are available. But it is more than just a checklist. It is a communication and teamwork enhancing tool. It asks that all team members introduce themselves and discuss any safety concerns prior to the start of the procedure. It requires the surgeon to tell the team what the critical or unexpected steps will be. After the procedure, it requires the team to discuss the plan of care for the recovery room and beyond so that everything is clear. And this simple communication and teamwork building tool has now been studied around the world and has been shown to significantly reduce both surgical mortality and morbidity. Here's a comment from a retired pilot in Quebec. Checklists have been used in aviation to standardize and increase the reliability of systems. One wonders whether such checklists would have been introduced much earlier in medicine if surgeons shared the fate of their patients as pilots share that of their passengers. We know how important and effective the surgical safety checklist can be, and that it fosters culture change. And that's why we have implemented it in all of our operating rooms at Trillium.